everyone, my name is Brittney Rosiles. I am an MPH candidate at the University of Nevada, Reno, and today I'll be presenting to you my student project. So I had the privilege to work with the CBESS program and support underrepresented and bilingual high school students. CBESS stands for Community of Bilingual English-Spanish Speakers, Exploring Issues in Science and Health. It is located within the Raggio Research Center in College of Education on the UNR campus. And so the Raggio Research Center and the university developed this program with funding from the NIH, the Science and Education Partnership Award, and the CBESS project is now being taken over by the Latino Research Center. And so as an intern, I am assisting the CBESS team with grant development, qualitative analysis, and evaluation. In Northern Nevada, approximately 25% of residents are bilingual. However, access to bilingual providers, translators, as well as bilingual resources are very limited. And so there's not enough diversity, especially linguistic diversity in the field of STEM and healthcare professions in Northern Nevada, especially in the rural counties of Nevada. And so this is a public health issue. And the goal of my student project was to address this issue. And in doing so, I conducted a literature review to explore how STEM and healthcare pipeline programs for students are crucial in their academic enrichment and in the future of the health workforce. And so when writing the literature review, I started the significant section of the grant proposal, and I helped to create a logic model of all of these CBESS project components and activities. And the population served through this student project were the student researchers and leadership trainees that are involved in the program. So the leadership trainees were essentially mentors to the students, and we have about 32 in each cohort, and they are Spanish English bilingual students that were selected from school districts here in Northern Nevada during the fall of their 10th grade to participate in the 17-month-long program. And students engage in many activities, including career exploration events, and we invite their parents, a youth-led research project, mentorship from the leadership trainees, and then some hands-on activities such as visiting the anatomy cadaver labs at the medical school here on campus. And so some of those program components include, again, the career exploration events and summer residential program, which allows students to really experience the campus life during the summer while doing research activities. Outreach initiatives, which allows them to interact with their community, and some mentorship from their leadership trainees, with teachers and counselors. When conducting my student project, I used the following methods to really help gain an understanding on the lack of diversity in STEM and healthcare. I looked at some secondary data, as well as reading over the previous grant proposal to learn more about the program and the grant requirements. I also conducted focus groups. I developed the survey questions myself, sent out the invites to all the students and their mentors from both cohort 1 and cohort 2. I hosted all of the focus groups, and in total, we had about 15 students from each cohort. That was 15 students from total. And I would have liked to have a little bit more participants, but it was definitely a busy time during the semester for the students. So it was a little bit hard to kind of manage with their schedules and everything. But I did record the Zoom sessions, transcribed them, and then created a qualitative analysis report to help make improvements for the program. And so as for the focus groups and the outcomes of the internship, the final products that I have were the grant proposal submission to the NIH, which was this month, and presenting the qualitative data from the 2 focus groups to the CBESS team and our partners. And so with this data, I was able to assist in evaluation and help make future changes to the program. As we can see here, some of the quotes from the students that mentioned that they did benefit from it and they did have positive experiences. And so about 95% of the students also indicated in surveys that they strongly agree that CBESS helps prepare them for applying for colleges and for a career in STEM and healthcare, which is really great to see. And in conclusion, for the results as well, we currently only have data on cohort 1 and 2. Cohort 3 is currently in progress, but we have had 100% of completion from each of the first 2 cohorts, as well as 100% of the participants graduated high school, and many are now in community college or at actually at our university. And like I mentioned, cohort 3 is currently in session. As for some limitations within this project, I would mostly say the data lacking some of the student data for the post program. So seeing how the program impacted the students, I really wanted to get a good picture on how CBESS has impacted students long-term and after they had graduated high school. And so I'm happy to say that I did get some data from that, which was coming from the focus groups as well. And students did show a positive impact, and a lot of them are now pursuing pre-med, dentistry, public health, engineering, as well as chemistry and biology. And actually a few of them are in the, one is in the medical school here at University of Matarino, and another in enrolled at UNLV as well. So very exciting. And as an intern, my goal was to successfully submit the grant proposal to continue to support and sustain this great program that I am very passionate about. And I really wanted to help increase linguistic diversity in the health workforce and in STEM, because I do really believe in how important that this is to really increase diversity within our workforce to help diverse communities. And so I'm really happy I got to be a part of all of this. I want to thank my preceptor, Jenica Finnegan, and my advisor, Dr. Julie Lucero, as well as the Western Regional Public Health Training Center for this wonderful opportunity. If anyone has any questions or would like to contact me, here is my contact information. Thank you so much.